morning, good afternoon, good evening, everybody, based on where you're joining us from. Welcome to SI Healthcare Hub event titled Exploring a Case Study of Systemic Design in Healthcare. Today we have Rosina, Joss, and myself from the SI Health Hub. And we are joined by Toban Shadlyn from Spain, who will be presenting a 6-year-long journey, a project of overdose crisis in the United States. To briefly introduce Toban, she is a strategic designer and educator. Her work is focused on fostering transdisciplinary collaboration, driving systemic transitions, and enabling place-based transformation. Currently, she is a director of the Master of Strategic Design at Elisava School of Design and Engineering and partner at Field State Strategic Design Studio. Thank you so much, Toban, for taking time and bringing us this case study. And thank you, everybody, for joining us, taking time to attend the event. We're really excited for all the insightful conversations that will unfold in today's session. Now, quick housekeeping notes before we move on. The session is being recorded so that you could refer to it later on our website and on LinkedIn. And this event will go on for about 60 minutes, and we will have question and answers session towards the end. So feel free to drop in your questions in the chat box so that we could pick it up towards the end of the session. All right. Thank you so much again. Over to you, Toban, for the rest of the time.
Thanks, Roma. And thanks, Roma, Joss, and Rosina for the invitation from SI Network. I've been engaging with this network for some time, and it's nice to be in conversation and be able to share the work and discuss it. So maybe just a couple of things to start off. So my background. Things are always changing. I am a strategic and systems designer. I'm also an educator and ecosystem builder. And my work really is about supporting change and working alongside others to do the same. And obviously training emerging practitioners who want to be working in different kinds of ways as well. So I work with a lot of different organizations spanning public sector, private sector, philanthropic, academia, et cetera, on a range of different domains, areas, challenges, focus. So I'm going to be sharing one in particular today. Let's see if this works. Can I get a thumbs up, Roma, from you? Can you see the screen? Just the black screen with the Systems Innovation Network? Okay.
I can also see the presenter notes and the timer on top.
Oh, you're on the wrong screen then. Let's try this again. How about now?
Perfect. Yeah, this is good.
Okay, no white. Okay, fantastic. So, yeah, as Roma said, if you have questions or comments or thoughts throughout, please add them to the chat. I am gonna try to not speak for too long, but we'll go through this and then I would love to open it up for conversation. So if there's things that you're thinking about during this, please write them in the chat so we can always come back to it and we can return to any slides or anything like that. So like Roma mentioned, I am going to be talking about an example from my work to ground this and make it concrete. This is work that me and my team at the Center for Complexity engaged with for about 5 years. This is very much a snapshot in time. The work is ongoing. It still continues, but this will be from about 2019 to 2025. So just to situate this work and provide a bit of context. So I was a founding member of something called the Center for Complexity at Rhode Island School of Design, which is a university in the US. And our mandate really is to apply creative practices to complex and systemic challenges in society. And we do that in a number of different ways. We operated as a design studio that works on multi-year collaborative projects with many different partners. We're also a research platform, bringing together diverse thinkers and makers, whether that was through convenings or workshops, talks, and publications. And we also taught. We were part of a university, and so teaching was also part of it. And it was a lovely kind of feedback loop between the practice and teaching and bringing students and other kinds of disciplines into this work as well. The Center for Complexity, it no longer exists today. It actually closed recently. But while it was operating, it focused on a few different areas in particular, a few different domains. So one area of work was looking at global security. Another area of work was around systems of care. And the third was around design and public policy. And we were, kind of a small team, but quite diverse, made up of designers and architects, but also sociologists, an ex-politician, a journalist, educators. So our team itself was also quite interdisciplinary, which was really valuable. And of course, engaging with many, many different stakeholders and partners and collaborators over the years. So I'm going to be talking in particular in one area of work that we engaged with for a while, which was in the systems of care, and in particular looking at the healthcare in the US. Specifically the overdose crisis, often referred to as the opioid epidemic as well. And for those who aren't familiar, the US they're calling it currently its third wave of the opioid epidemic. The first wave began actually in the 1990s when pharmaceutical companies aggressively promoted prescription opioids or pain medications, while also minimizing the addiction risks. And this led to widespread prescribing of these drugs and patients becoming dependent on them. And so as medical awareness grew, doctors began prescribing less, of course, but many people, you have a sort of a whole population already dependent on these drugs and could no longer get them from medical outlets. So they turned to illicit markets and opioids, at the time, particularly heroin, which was the second wave. And over time, the illicit drug supply in the US became increasingly dominated by other kinds of substances like fentanyl, which is much more lethal and potent. And that's the third wave right now. And so that very much exists in the market. And this, people often don't know what is in their substances that they're taking, and they don't know the quantities and the amount and potency and taking them without knowledge. And unfortunately, overdosing and dying in massive, horrible amounts. So this has been going on for over 20 years now. So it's an intense topic. So I maybe wanted to just zoom out for a moment, and I'm going to use this as an example because this is work that I deeply know. But I think I'm going to frame this talk around these four kind of key fundamentals of doing this kind of work. What are the fundamental concepts or approaches or mindsets or ways of working that show up for me in other work that I do in other topics or other domains. And these are the things that I think are applicable to the other contexts that we're all working in, that are useful to pull out of case studies, for example. So the first one is understanding phenomena, right? I think one of the most important aspects in engaging with any domain or topic or site is to first understand what I call the phenomena that we're working or engaging with, from multiple perspectives and multiple timelines. So what I mean by this is we need to have an understanding of what are the past logics of the place or the culture or the system, and are these logics still present and active today? Another way of saying that maybe is, what are the epistemologies or knowledge sets or mental models that we are holding true and making decisions from in the present? And are they flawed or are they erred? And do these paradigms or ways of knowing need to be updated as we move forward? So before we even begin to imagine and design alternative directions or futures, it's imperative that we understand, again, those past logics and tracing histories and those decisions over time, and how they, again, may still be persistent today. And surfacing this gives us the agency to ask ourselves questions like, what are we building from? Or perhaps, what are we keeping? Or what do we actually need to let go of and start anew? And I say this because I find oftentimes with my students and collaborators, there's sort of this excitement and allure of designing the futures part, the directions. And we get into danger if we don't first, what I call unveil the logic, sort of the narratives of the past and present before making any sort of like as a way to make assessment and begin designing different directions forward. But we need to be aware of those logics first. So in the example of drugs and addiction in the US, the country has a long-standing history and relationship to drug use. My learning began with a lot of reading, a lot of research into this space, and went far back into history, looking over 100 years ago to really understand the shifts over a longer period of time. And this was incredibly useful for our teams, but also when we were working with many of the stakeholders and collaborators in this space as well, to do that kind of tracing of histories. And it started to reveal and connect many of the invisible and the intangibles and the forgotten stories, let's say. So this is a very simplified and simplistic way of describing this, but I'll share a little bit of what that kind of tracing or unveiling looked like in this case. So the system in the US today was built on a lot of false narratives and false evidence. So propaganda that was shared via widespread media campaigns throughout the 20th century. And this created a narrative and a belief amongst the public that drug use was considered a moral failing of the individual. This led humans, at the time, different government bodies, entities, to design a system and an approach that decided to label drug use as a criminal activity. Prior, it wasn't. And this enabled the system to then create policies targeting certain groups of people, often discriminatory or racist policies, and eventually disproportionately incarcerating people of color, and has created or led to quite a harmful health market that we see today. So this deep historical understanding was really fundamental to shaping our own thinking, and again revealing where does change need to happen. And often it's in these so many of you are probably familiar with iceberg model. I think it's a useful framework to think about, but you can already see those deeper layers, right? Trying to affect change or shift around shared concepts and mental models. Even the language that we choose to use shapes how we think about something. The knowledge systems, the public policy and regulation, et cetera. So these are some of the layers that if we want to start changing parts of the system, that these are probably some of the areas that we're going to need to address. But understanding phenomena, we also needed to gain an understanding of the current situation of this crisis. How is it actually showing up today? And so we focused on specific context in which we were working and living at the time, which was the state of Rhode Island. And context really matters, right? Although this challenge is national and widespread, it shows up really differently across different regions, different states, different counties. And so that context is really important. As you can imagine, one thing that we were really conscious of started is the sensitivity of a challenge like this. This is a space that has experienced over time tremendous harm and trauma and extraction and stigma. And we wanted to make sure that we weren't reproducing those same harms. And so this really required an approach of humility. And that humility was one, actually, to not assume that our team had any role to play in even engaging with this challenge in the first place, and to be open to that. And if that was the case, then to not get involved and not again produce unintentional harms. And that second was then, and therefore, to really take the time to understand what was going on in the space. And the way we went about that is we began showing up in different places, different parts of the system over many, many months, and repeatedly over and over again. We did that without the lens of designer hat or goggles, without the sort of disciplinary bias, so that we weren't sort of projecting a kind of analysis or assessment of understanding what was going on without the lens of being like, this needs to change or how do we intervene, but just to show up simply as observers and listeners and just to hear what was going on as humans, as community members. So we ended up attending a lot of different local events. We attended public meetings that the governor hosted every month at the State House. We created our own site visits. We volunteered with social workers in the morning for outreach. We joined local groups like reading groups. And again, we did this over and over again. And what this allowed for us is to be able to understand, again, what was going on in different areas, but it also enabled us to meet people and to build relationships over time and eventually build trust with different communities and stakeholders because we kept coming back. We kept, meeting the same kinds of people over and over again. And this was really fundamental and foundational to any of the work that we did is the spending the time investing in building those relationships and building that trust. So often we talk about a portfolio approach to intervening in complex challenges, which I'll get to in a second. But for us, this also meant actually bringing a portfolio approach in understanding the current condition. What are all the diverse ways that we can learn about what's going on, and sort of again bring a portfolio approach to that as well. So I just want to offer that because I think there's multiple ways that we can think of a portfolio approach in the work that we do. Of course, this idea of understanding or identifying the problem and creating a solution doesn't apply to working on a challenge like this. There is no single bullet solution that will work. Even this language is problematic, right? It influences how we think and how we approach something when we frame it in this way, and it oftentimes biases ourselves towards what I call it like a deficit-based approach rather than an asset-based approach. So you're sort of looking for the problems, the deficits, rather than sort of looking at things from a broader, more holistic perspective. So when engaging in areas that are complex, there are many interconnected facets that we need to consider and understand. And given that, it's going to require actually a multiplicity of responses in order to affect change on these ecosystems, aka a portfolio of interventions. What are all the different kinds of ways we can apply pressure, sort of acupuncture points to start shifting and reshaping? So in the case of the overdose crisis, the phenomena touches everything from policy to addiction and recovery to both the medical and criminal justice systems, to illicit and informal markets, to employment and housing, et cetera, right? There's a whole ecosystem, and I could add more petals to this diagram. This isn't all of it, of course. And so then the purpose of a portfolio of interventions that we developed and supported over time are, in service of reshaping this interconnected ecosystem. So what did the portfolio of interventions look like? Like I mentioned, many of those early engagements of us showing up in the community led to a snowball of activity. So I mentioned we attended community events. One of them was a hackathon, and through that we ended up receiving grant funding to develop projects with community partners. And we did this in collaboration with nurses, with community service providers and researchers, and we developed proposals for new kinds of care spaces, new kinds of care treatment, and new kinds of care teams. And we tested these ideas, these proposals with different stakeholders. And the purpose of these sort of provocations was to use these concrete ideas and put them into paper rather than just intangible ideas. So even just kind of moving these into a more diagrammatic or visual form and putting these ideas down in paper, we were able to build a shared understanding, to build with different stakeholders, because we were all looking at the same thing. We are able to also use these to, again, continue to build relationships, but also learn and sort of suss out what the readiness level of the system was for change. what is the response to a different kind of care space in the state of Rhode Island? What is the response? What does that bring up for people? What are people's, people or the system's readiness level for that? We also co-designed and mapped out with healthcare professionals and people who use drugs, both the current existing systems, like actually mapping out and drawing the different kinds of care facilities and sketching that out, and also sketching out future alternatives based off of these insights. So, for example, we were using drawing techniques instead of simply verbal interviews. And even in doing that, it revealed totally different kinds of new information. For example, I remember one engagement, someone was telling us about what the experience was waiting in line outside of these care clinics, and sort of drawing that and telling us about, even before you get into the care clinic, there's a whole other experience that happens that no one is talking about or paying attention to. And so these folks, of course, they both are stakeholders with lived experience, but they also have deep, deep knowledge and expertise. And some of them are in positions of power to influence change. And so it was important to bring that kind of knowledge into these conversations. We also traveled and spoke to different practitioners and networks around the world, for example, at conferences, opening up our learnings and experience with others for conversation and to learn from others. So this was a conversation in Bilbao that we hosted, discussing the how of collaboration amongst interdisciplinary teams. So this was a group of folks from the world of science, from the world of design, and talking about how do we actually collaborate across these very different disciplines and very different worlds. What is it? What does collaboration actually need to be and look like, and how do we do it? Simultaneously, we were conducting research on different care spaces and programs around the world. And we were presenting these learnings, for example, on safe injection facilities, which were, these exist all around the world, but safe injection facilities were illegal in the US to open and operate at the time. And so we were, doing this research and then presenting it to policymakers in the state of Rhode Island to help inform the writing of new legislation, because they were trying to pass the safe injection sites to make them legal in the US. One of our interventions, a bigger one, came from an insight that we had early on, which was there were many spaces for people in the state of Rhode Island to come together and exchange information. So to share and transfer new knowledge with one another, like the newest research or newest data on, let's say, hospital overdoses. But it was a lot of just sharing information with each other, which was really important. But there wasn't a lot of opportunities or spaces for people to come together and collaborate and create new knowledge together. I'm sure this is familiar for a lot of us in our different contexts. A lot of us, engaged in this work, we work in silos, and we don't have many great mechanisms in place for people to work across those silos or across these disciplines, and definitely not in Rhode Island at the time. And so how can we go from this kind of a shape to this? How do we create the conditions for dialogue, for building shared language and shared decision making? And how can we honor, again, the different kinds of expertise and experience? This challenge is so interconnected, and it requires a shared effort amongst all these people, all the different actors in the space. But these mechanisms actually need to be designed to hold space for that as well. So we facilitated a series of design studios, is what we called them, with a range of different stakeholders. You can see some of them here on the screen. Community groups, we had policymakers, different kinds of healthcare professionals, family members who are going through this, artists, people in recovery. And because my background is actually in architecture and design for the built environment, I think about space a lot. I have a bias towards thinking about how we design space. And I like this quote: if you want people to have a different conversation, rearrange the chairs. And, I think as designers, we know that the power and the effect that designing spaces or an experience or even a conversation, how important that is. And in this case, that meant, again, bringing in these diverse perspectives, but it also meant creating the conditions for, somewhat trying to equalize the power imbalances that exist across the actors in this ecosystem, and again, respecting and bringing and sort of honoring again the range of expertise. Maybe just a side anecdote here to make that a bit more concrete. We heard from many people with lived drug use experience, people in recovery, that often they're invited into these meetings and conferences to share their story. And there's a tokenism that comes with that because they aren't actually invited to be co-decision makers and co-creators at those tables or in those rooms or in those conversations. And so that shift needed to happen, right? How can all the different actors have agency and be, co-decision makers, especially those with that kind of lived experience? So one of the purposes of the studio was to bring coherence and alignment amongst the different many areas and actors, whether it was around care treatment or policy or housing, et cetera, and to figure out, around where the state of Rhode Island wanted or needed to go. What is the direction we're trying to go as a state? And to then develop an articulation of those preferred futures or directions. So in order to do that, part of this work involved developing new capacities together. And one of those capacities is how we frame challenges. Again, how we frame something informs how we approach and the perspective on this. So I call this balancing the conceptual and the technical. And maybe a way to describe this is called the Steinberg funnel, created by a colleague of mine, Marco Steinberg. And the way that it works is, you have on the right side, it's sort of a narrow end of the funnel, and on the left is a wider end of the funnel. And on the further sort of up you go on the wide end, the more possibilities, the sort of broader the question sets are. And the narrower you go, is sort of making our way down decisions and possibilities or possibility frames. So in the studio, we asked a portfolio of questions, different kinds of questions, both from technical and narrow framing, but also broader and more conceptual set of questions, because this changes, again, the way we ask questions changes how we think and the kinds of possibility space that it opens up. So on the more sort of narrow technical end of the spectrum, we were looking at questions like how to reduce drug use, or how do cities address the unregulated supply of drugs. But if we push further up the funnel to the more sort of strategic, broader conceptual side to the left, we were asking questions like, what would it mean to rethink what place substances play in our society? Or what would it mean to explore what conditions enable a society grounded in care, well-being, and human dignity? And so again, all of those questions were important, but even just in the framing of them, opened up different kinds of conversations. It helped open the group thinking up and loosen sort of the rigid logics, and gave space to rethink our relationships, or again, these paradigms maybe that we've just sort of accepted over time, and to renegotiate those. Another capacity and approach to working on these complex challenges is that it requires us also to not, again, be tied to rigid structures of knowledge. We have the agency to order and reorder information or knowledge in service of breaking free from set ways of knowing and open up, again, new ways of seeing things differently. So, for example, in the opioids work, what did this look like? Right, I mentioned these earlier. And for example, we identified new kinds of narratives. So if one of the existing narratives was that drug use is a moral failing on the individual, actually a new narrative was looking at replacing that old one and simply actually just understanding and accepting that it's part of human nature. Addiction is part of human nature. It's physiological. It's hardwired into us. And we have different kinds of addictive tendencies. So it's not a moral failing. It's just part of the human condition. And this unlocked the ability to apply a new categorization then to address it. So instead of it being a criminal matter, if it's part of human nature, can we categorize it actually as a health matter, something to be addressed from a health approach rather than a criminal approach? Which meant that a new approach would be more appropriate. So shifting from putting people into prison and solitude, can the approach actually be about developing different kinds of supportive pathways to well-being? And what would that look like? So this was sort of, again, looking at unveiling those past logics and narratives and approaches and reconsidering and rethinking them, redesigning them with different kinds of ways of thinking, a different kind of paradigm, let's say. So these were useful, and they helped the studios, propose future narratives and new logics that supported this shift towards creating a compassionate health system, a more compassionate health system for all. And the collective was able to then create a series of different proposals and directions grounded in these new logics, ranging from expanding specific health services to surprising and more accessible care spaces. For example, a group sort of designed what an overdose prevention site or a safe injection facility would look like in the state of Rhode Island. Some groups created a manifesto for a true system of care. But again, all of these ideas and proposals were in service of shifting different parts of the system. Beyond the actual, let's say, proposals and directions, the studios were also an intervention, though, in and of themselves. So it was an intention to actually create the space and time with people in various positions of power and decision-making roles to come together and aligned around these future directions in order for the state to move forward. And to support setting up coordinated efforts. And so, in a sense, the studios were really about focusing on that relational aspect. How do we actually, develop and build stronger relationships so that we can coordinate and, still go back into our own parts of the system, but and work on influencing change, but in a much more coordinated way. By the time we had started running the studios and convenings, the landscape around us was also shifting drastically. So around this time, the COVID-19 pandemic was spreading. We were seeing massive financial settlements coming into states from suing big pharmaceutical companies. And actually, the state of Rhode Island had just passed new legislation allowing these safe injection sites to open up, becoming the first state in Rhode Island in the US to do so. So this required what we refer to as dancing with the landscape, right? As the landscape is shifting, we also need to shift with it and change and pivot and continue to align and position. So we began actually teaching courses at the university, bringing designers and creatives from a range of different disciplines like graphic design, industrial design, architecture, to now think about what do we need to consider in these care spaces now that policy has passed. And we also brought in community stakeholders who are working on these challenges into these conversations with our students to open them up to new questions, new framings, new ideas that they could then take back into their organization and into their spheres as well. Some images of some of the work that our students created, a range of different provocations from thinking about different scales and layers, from products and services to new spaces and programming and new narratives and mental models. This work actually ended up getting picked up in the media. And it was interesting. It started to shed a new light and a new tone on the opioid crisis. So much of the news on this topic, the language and the tone was quite hopeless. It was quite stigmatizing and quite charged. And it was interesting that the messaging started to change a little bit, that it sort of struck a different tone, one of creativity and collaboration. And so this was sort of interesting. Some of these things you can plan for, but some of these snowball effects are quite emergent. Often, many of us, and I will say designers, but also non-designers, I think we tend to have, again, we tend to look for problems or this deficit-based approach, what's not working. But it's extremely important that we also look again for the strengths, this asset-based approach. What is working? what actually just needs to be amplified or supported or expanded or resourced. And there was a lot of organizations and activity in the state at the time. And that was one role that we could play. How could we support and uplift what already exists, what's already working, and who's doing that work? So one of these efforts, we collaborated with a community organization and a health research center to create an exhibition of a mock safe injection facility. So again, a safe injection facility is, for those who don't know, it's a place where people can go take their drugs and test them and see and make sure that they know what's in their drugs and can use them safely with care, support around them. Again, this effort was prior to the legislation passing in Rhode Island. So we were doing this. The reason we had to do a mock safe injection site is because they weren't legal to open and operate. So we ended up creating a mock one-to-one scale version of it. And so the purpose of this exhibition was, again, to invite and allow the public, whether it's business owners, schools, policymakers, neighbors, to come in and actually walk through and experience these spaces to understand what happens in these spaces, what are they there for? And so we use the exhibition, the mock space, as a learning tool and a conversation starter. And part of this started, again, before the legislation was passed, and it was to get ahead of things like NIMBYism, not in my backyard, but also to help influence policymakers in making these spaces illegal, or how to, again, frame the legislation or the writing in order to pass. It was also a way to make tangible and real what had been a very abstract and conceptual and foreign idea for people. Not many people had stepped foot into an overdose prevention site or a safe injection facility. And so everyone had different notions and ideas about what these spaces would be and different assumptions. And so this was a way to actually build a shared understanding by mocking something up one-to-one scale and experience something, to actually move through a space and learn about it. And almost have different kinds of conversations because they were grounded in some sort of shared reality. These exhibitions traveled to different places around a couple of different states. And we started to, what we call sort of a Trojan horse approach. We started to, in these mock exhibitions, start mixing fiction with reality. So we started to embed artifacts, like some of the ones our students created, like new drug testing products that aren't actually on the market yet, into these exhibitions. Again, to begin sparking conversation about the future design or the future potential of these care spaces. So to not be limited by existing examples from around the world, but can we also start to embed other kinds of questions and conversations using some of these fictional artifacts to prompt a different conversation? And so, for me, that was a nice opportunity and a good example of the mixing of the science and design world and how these things can come together. It can be incredibly difficult to trace and measure the outcomes and impacts of doing this kind of work, as I'm sure you can imagine. It's not as clear to suggest that, we did this and therefore this happened. It may be more close to a loose correlation. We did a bunch of things, these things that I just showed, with a bunch of people, and these things started to shift in the landscape or started to shift the context. It's also obviously hard to measure because of time, right? These things take a while to change, whether it's mindsets or policies. And so there's something important, I think, hopefully, about being able to stick with something long enough to follow that transition over time, to see things shift, and again, to dance with the landscape, to be part of being able to respond and adapt as the landscape continues to change. So these are just a series of news clippings to maybe show some of that story over time. In 2022, Rhode Island became the first state in the US to legalize these overdose prevention sites. It took another 2 years in 2024 for the state to actually approve construction or the proposal of the first one, and then took another year to construct it and eventually open door to the first state sanctioned facility in the US. So that's already a 3, 4 year time span. And there was 20 plus years before that of incredible advocacy work and grassroots activism happening. And yeah, just incredible efforts by the communities there. So this, again, what I just sort of ran through very quickly, portfolio of interventions that we developed and supported were, again, in service of reshaping this system, right? Kind of an acupuncture, applying pressure to different parts of the system over a long period of time in collaboration with many, 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 many people. So I'll end there. I am holding a lot of questions for myself in the work that I do. So 3 ones that I'm sitting with, I'd love to hear the questions or comments or reflections that you're all sitting with. The ones that come to mind for me are around, role. What are the roles needed? What does resourcing look like? And how do we design time? So I'll stop there and maybe stop share so we can see each other's faces.
Thank you, Toban. That was an amazing in-depth case study. We have a lot of questions in chat box, if you see, and a lot of questions from Lakshmi at the Care Lab. Would you like to unmute Lakshmi?
I'm sorry, but Toban said pop questions as she goes, so I went a bit crazy. So I don't want to hog all the Q&A because we know each other and we can also talk afterwards. But I think, one of the questions I had, and I don't know how many designers there are on this call, but from the Care Lab, where we're designers working in this system transformation space, I'm really curious how you see finding a balance between the humility to show up in these communities, kind of just as observers, listeners, participants, and not kind of take our design capabilities out at first glance, together with then finding ways to contribute really where design skills can help move things forward. And I think the prototyping that you showed is an example of that, and the student work as well is an example of that. Like, how do you straddle that tension between contributing in a designerly way and just being with these communities as they find their own ways, to drive change?
Yeah, absolutely. I think spot on, right? The keyword balance, balance and discernment, I guess. I think that obviously the context matters, and in this work, for example, I think because of the sensitivity of the topic, and the kinds of folks that we were engaging with, it just was very present and top of mind to really be very conscious about how we were showing up, where we were showing up. To the point where, again, that's why I say, even in that case, oftentimes I was showing up as a community member, and putting the professional titles at the door and not introducing or fronting that. But I think over time, I think that time element was really important, because as we were meeting more people in different communities and in the area, it was through just those conversations of understanding, where are the challenges, where are the pain points, where are the opportunities, and it kind of happened through dialogue, and in speaking with people to I think develop some of that collective sense making around what could happen, or what could be done, or what could we do together. And I think once then we sort of, agreed with enough community folks and stakeholders, and people were engaged, then it was a matter of, I think, having a bit of a heavier hand in the design side, or at least bringing in and advocating for different kinds of approaches, but also keeping the space for all the different kinds of approaches. It was a lot of collaboration, with the scientists and the designers, for example, or even just, having conversations with public health researchers. They had a completely different way of defining evidence. than we do from a maybe design perspective. So it was this dance, I think, of when do you kind of lean in and when do you lean back?
Yeah. But starting with the trust piece, the relational part, building the trust before you even get to that conversation. Yeah, thank you.
Yeah, exactly. Or those conversations would have gone so differently or not have happened. Yeah.
Perfect. Moving on, we have a question from Alicio. I believe there are two main ways to make innovation and change for the better happen. See the problem and try to fix it with a solution, or understand and clarify the need and find the best way to fulfill it. I think it's a comment more than a question. Moving on, Jennifer, did your team help to facilitate multi-stakeholder dialogue after they had interacted with the overdose prevention site prototype?
Yeah, we did. We did hold, like, we hosted some of those conversations or facilitated some of those conversations or dialogues. We also attended, other people were hosting those dialogues and conversations. So for example, the State House they had an open, like a public engagement, for example, getting feedback on how they were writing or drafting the legislation that they were trying to pass. And it was, because it was open to the public, anyone could attend. And so we attended those. And so it was in conversation that we also got to participate and give feedback on, for example, making sure that the way that they drafted the legislation was going to be equitable and not exclusionary. That there were certain ways that they were drafting it at the time that was actually going to make it very impossible for most organizations that were likely to open up these spaces to not be able to actually open and operate them. So we wanted to give them that kind of feedback and ensure that they wrote it in a way that was going to be much more inclusive. So yes, we did. We did, and we took. We had surveys, for example, from the exhibitions, and those anecdotes came into those public meetings and in conversations with policymakers, for example. And it also informed in the studio with a group that was designing these overdose prevention sites, and that piece of research was also going to be shared with the organizations that were going to open up these spaces in the future. So there was a trickle of like how information flowed through these different networks.
Thank you. Next question from Jennifer again. What kind of mapping or frames did you use to decide which petals would be prioritized for interventions?
We didn't really prioritize certain petals. The petals actually kind of emerged from the different people in these studios. So if we had someone from a housing organization, they would probably, put housing on the table for conversation. Or if we had, someone, a recovery coach, they would probably put recovery services and programming and resourcing on the table. So, we had law enforcement there. They brought in the perspective of what it's like to be a frontline engaging with this challenge on the streets when they weren't necessarily trained or equipped to deal with it, but also the kinds of, let's say, drug supply that they were picking up off the streets. So they brought their own priority and perspective on the table. So it was very much, it emerged from the kinds of people in these studios and in these conversations and dialogues. And because we were then grouping people together and to have a policymaker work with somebody who was in recovery, work alongside a nurse and law enforcement in a group, the interventions kind of emerged from that mashing together of perspectives. And that helped enrich something like the design of a overdose prevention site, for example.
And can I ask just a follow-up question there?
Sure. Yeah.
So then once you had sort of a group of people that maybe were engaged in the same issue and there was a little momentum there, did then your group from the design school then support them as they move forward?
Yes. Yeah. And that was a really fascinating journey because as you could imagine, what's interesting about this is, yeah, when you bring these kinds of diverse perspectives together, not everyone agrees. There's fighting, there's tension, there's power imbalances, etc. Right? So there's a lot of dynamics at play, and there was a lot. Our team, because we were facilitating and hosting or like convening those spaces, we did a lot of work with the collective to work together on how we were going to tend to those tensions. What are the terms of engagement with each other? And it was a lot of human work, let's say. But also, also it was interesting. There was one group, for example, that was a group of healthcare professionals, and they were really uncomfortable engaging with something that wasn't a white paper. That was that is the currency, and that's fine. That's good. That works in those environments, and that's necessary. But it took some inviting to give them permission, actually, to explore differently, that they didn't need to write a white paper as a result of their conversations and proof of evidence that they did something, right? So it required some permission giving, and then working with them to then brainstorm, like, what did they feel comfortable with doing? And that was actually one of the groups that created a manifesto, because that felt creative enough to just get them to break out of their usual ways of working and express themselves. And actually, what was really interesting is it led to a whole series of conversations and questions that led to a bunch of like research proposals that came out of that around. We've always been talking about what, like, from a scarcity mindset. So all of their work was often from a scarcity mindset, and giving them the permission to think different, to just be in a different kind of exploratory playground space. They started to think about, screw the scarcity mindset. What if we had an abundancy mindset? And we started to think about, if everyone in Rhode Island wanted to have a bed or a house, or a bed to sleep in, or certain kinds of access to recovery services, how many would that be? Do we actually know how many beds we would need in the state of Rhode Island, or how many peer recovery coaches we would need, et cetera, et cetera? So it changed the whole sort of thinking around it as well.
Great, thank you.
Yes, Joss.
Yeah, I don't want to take too much time because there's quite a few other comments, but thanks for the presentation, Toban. Two points there. I mean, that one about power and and who has it, and if it's co-created, then there has to be some distribution of power, isn't there? And like, how did that come about? Normally in these systems, there's ultimately some authority or someone who kind of holds the power around these things, and how do you manage to create those spaces that allows for this kind of work, I guess, is an interesting question. But before that was kind of the question around intervention points or leverage points. Maybe you answered the question already, but that's a key one that people always ask, like, how do I go about finding these intervention points or these leverage points? And I don't think there's a single answer to that. I don't think there's an algorithm or anything, but if you had any tips, like based upon your experience, I mean, I think it's quite context specific, and you have to really kind of work through the whole thing and the mapping and everything. But if you had anything you might be able to share about, how you try to find those intervention points, you shared a little bit already, but is there anything else?
Yeah, I think a couple things come to mind for me that I do think are applicable in other contexts, which is, I think there is some sort of like tapping into or gleaning what is the readiness level for change in these systems, and where is it? For example, I have a friend, a colleague, who was working in food system transformation somewhere else in the world. And one of the levers that we normally think about going to is a policy lever, and trying to affect change there. And that wasn't going ahead. Like, it was a closed door. And so they're like, okay, if that's not one of the levers that we have access to, or that's not ready to change, then let's find some other entry point. And so they started and went sort of the business route and created a new market for food, and created a whole new venture in entrepreneurship, and connected with farmers. So they found a different kind of readiness level for where to intervene, or where that lever is. And I think maybe then the ingredients for how we discern that is, again, a bit of the time approach. Are we able to stick with something long enough to engage with it, to understand it, to see it shift, to try things, and if it's not working there, to find other kinds of leverage points. But I do think there's a really important time condition that oftentimes we're not, the way that our work is structured for so many of us, it's not designed in those kinds of realistic time cadences. We often have quite time bounded projects and engagements, and that's, I think, a barrier to being able to discern that and then stick with it long enough to see where the leverage points are and to try different leverage points. So again, that's why time is one of my big questions on my slide.
All right, thank you, Tobin. We have a lot of questions actually in the chat box, but we have very little time. So we'll try to take a couple of them for now. Jean, okay. Lakshmi, can we go next? Yeah. Jean asks, what things did you learn along the way that were real surprises?
I don't know if this was a real surprise necessarily, but I guess I just, one of the things that we were talking about actually before this talk with the team at SI Network, this topic can be heavy, and it's full of sadness and trauma, and not the lightest. And I what's interesting, I think, for me is I have never felt so like energized and inspired by the people working in this space. I mean, the work and the commitment and the tenacity of people working in this space is just, it's so inspiring and it's so incredible, and it makes working in a space like this really meaningful. So to me, it's the people. I think, again, not surprising, but one of my biggest takeaways of being able to work in this space and with these kinds of communities.
Right. The next question is from Rosina. I'll club both the questions. What balance of effort was in the process versus looking for resources for its long-term sustainability? Is it still ongoing? And why did the Center for Complexity in the university close?
I'll start with the last question, which there's, I don't know if it's an easy answer. There's multiple reasons it closed. I think one of the big ones is the shift in administration in the US was a big reason, with the Trump administration coming in, cutting funding. So that's that. And in terms of balancing of resources, I mean, it's maybe a complex answer because because there's so many stakeholders in the space. The balance of resourcing is different for each organization or each stakeholder. So we had our own, let's say, resourcing. Let's say from a financial perspective, we were funded from a tech company, and we had a lot of leeway and autonomy in deciding how we worked and how long we were able to spend working in certain spaces. Whereas some of the community-based organizations are operating from a scarce, from scarcity resourcing. But the interesting side of that is, again, the landscape was shifting, and a lot of states in the US were about to receive huge settlements from big pharmaceutical companies in lawsuits. So the community in Rhode Island was strong enough and powerful enough and had enough agency that they were able to help the policymakers at the time figure out where and how to deploy that funding throughout. And thankfully, policymakers were open to having that intel and advice. So that was an interesting ongoing conversation around how to kind of collectively decide where resourcing should go, and where it should be distributed towards. So that's maybe from a financing resourcing perspective, but there's of course a lot of other ways to think about resourcing. From a human capacity perspective, there's a lot of people that burn out in these spaces, nurses who are on second degree kind of burnout. And yeah, so there's a kind of like, how do you care and support and resource each other? That needs to be there as well. So you can think of resourcing in a bunch of different ways, and it looks maybe different for those different aspects.
Thank you so much for that, Tobin. We have a few more questions. Are you okay running over time? A few more minutes.
I can stay, yeah. If people need to drop off, please go ahead. But
Okay.
thanks for coming.
All right. Actually, there's this last one question from Andy. Now, he asked, if you ask people to look at a problem, they do it from their own perspective and lens, right? A finance person will see a money problem and a mental health worker will see the distress. I'm sure Eckhoff said it better than I have. Was this an intentional, appreciative inquiry approach then?
Yeah, it was. I think, I mean, to that point, right? Like the framing we put on something is oftentimes it'll bias the lens we have. So whether we frame something and we're looking for problems, then we're gonna find problems. Which is fine. That's important too. We want to solve problems. That's important. But that's a narrower scope. And it's missing incredibly other important factors to look at. So it may not have been super intentional at the time in terms of like what else we were looking for. But again, I think that kind of a bit of neutrality in the looking is helpful. So it didn't take us long to stumble upon all these incredible organizations doing really, really important, powerful work. And it was working. Like the mock overdose prevention sites was already in the works, and we came on board to help, design and support it in other ways. But that project was already happening, and it just needed a different kind of amplification and different kinds of support and capacity to wrap around it to make sure that it had a certain kind of impact. So yeah, that asset-based approach and looking at things from that perspective too is really important. And if we're not looking for that, then we're gonna miss those opportunities and the moments to strengthen and support things that are going well and things that are already working.
Amazing. There was one question from Lakshmi. I think we addressed it. It had some overlap with Rosina's question.
Lakshmi, are you good? Okay.
Okay. Perfect.
Good, thank you.
Thank you so much, everybody, for showing up today for this amazing presentation. Tobin, thank you so much for sharing such an insightful case study, which has like on ground kind of what should say on ground, like it's happened in real basically, which is not very often that we come across these case studies. So thank you so much and answering all the questions. And there are a lot of claps, a lot of good comments in the comment section. You will love to read them. But overall, it was a great session. Thank you so much. Would love to have you back in future, Tobin, for one of our events, maybe. But otherwise, thank you so much, everybody. Again, have a great day, rest of the day, and good night if you're from India.
Take care, guys. Thanks a lot, Tobin. See you soon.
Thank you. Nice to see everyone.